All right. Well, hello, everybody. Happy Tuesday. I'm Dr. Roney, and welcome back if you've been on before. And then if you're new to the cancer conversation, I want to take the opportunity to welcome you. I am here with Miss Ashley Serna.
Hello.
Miss Ashley does works the Firefly and the F-Scan.
Yep.
And we are going to talk heavily about that, and we're going to talk heavily about parasites. So this is a good one because I think going back years, we would hear, oh, somebody has parasites or whatever, and it's just like this overwhelming, they found it easily, they were in another country, they came back, they had a lot of symptoms, they go, it gets tested, it's positive, and then they get rid of it, right?
Right.
Well, that's one part of it. So as an example, I had somebody from Peru. She's like, oh, we had parasites all the time. We just took something. I don't think I have them, right? You probably hear that a lot.
Right. I regularly tested while I traveled, or I went to Mexico and I came back with something. But we don't really talk about the day-to-day parasites that we can be getting here.
That's what we're going to do, because a lot of patients, me included, would say, well, I don't really have that many symptoms. I don't feel like my digestive system. But then when you start really, I think, going into the symptoms and understanding the symptoms, you're like, oh, it's a strong possibility.
I kind of have this. They start to all kind of add up into multiple symptoms.
Exactly right, which we will go over. You know what that is, Shep?
Yeah.
Okay. Shep's going to fix that if there's an echo. Okay, so with that, we're going to walk through kind of a step-by-step of, I want to explain the immune response that happens in the body, right? And explain what exactly happens. I went through it heavily over the weekend, just the review. It's a lot, but I'm gonna narrow it down a little bit and make it digestible, right? So we'll definitely do that. And then I want to tie it to where, okay, well, how does that affect chronic disease, like cancer, for example? So I want to tie that in, and then I'll turn it over to Ashley so she can go through, her training on parasites and the F-Scan and the Firefly, and we'll conjointly talk about other treatments for these parasites, because sometimes, as we were talking off screen, the F-Scan and the Firefly are really good for identifying and then killing those parasites, which Ashley will talk about. However, it could be one tool in the toolbox that's needed in order to kill them. Would you say that's accurate?
Absolutely. If it's a brand new infection, it might just take a few treatments. If it's something you've had chronically, we might need more than that. We're all about using all the tools in the toolbox. We don't really ever treat anything in the clinic with just one thing. It usually takes a combination of a few things. Yeah,
and I think that's always what I've seen here, that layering is what makes the difference. It's very effective. So that, because a lot of patients will come and say, oh, I've had that treatment, or I've done this and I've done that. And then I ask, well, did they test to make sure it's all gone?
Right.
Oh, I can't remember, so, but the other part of this too, that I'll mention just briefly, is if we do have parasites or candida or some of these infections that can really wreak havoc on our systems, we also want to make sure that we're healing the gut simultaneously.
Right.
And I think that's a big factor. We want to make sure that there's a plan to increase the acidity in the stomach. Usually it's low, and the enzymes and the microbiome and the leaky gut. Make sure there's short chain fatty acids, and our immunoglobulins are strong, and our secretory IgA. There's a lot to it, beyond just getting rid of the infection. Because again, one of the things that happens is we'll get rid of the infection, but the gut's still weak.
Right. Or it can come right back. If the gut's not strong, you can be exposed the following day after you've cleared it, or have other gut issues that are going to remain.
Exactly right. So I'll touch base on that too, so we can really go full circle with, identifying and killing parasites, but also making sure the gut's strong simultaneously as well. So briefly, I'll go through, as you know, if you've been on, I'll go through our 4 pillars briefly, because especially as it relates to chronic disease and cancer, I want to make sure, if you're new to this, that 4-pillar approach, you at least understand briefly a plan that no matter if it's here or another clinic somewhere, you're applying that 4-pillar approach, because that's what we've seen work really, really well. This is within the 4 pillars. Parasites are in that 4th pillar, which are the causes.
Right.
and we'll explain. I'll explain immunologically what happens, and then what happens to the cells and why they become damaged as it relates to it. So, pillar one, briefly, is the testing. We want to make sure the testing that we're doing is more individualized, right? So there's the cookie cutter, and then there's more individualized testing. Now, these are scans, and they could be the blood work and urinalysis and things like that, that most doctors or conventional oncologists will do. We're going to do those if need be, but then we'll get into the circulating tumor cell tests. We'll get into nagalase and PHI and D-dimers and the cancer tumor markers. We'll look at the nutrient value of the cell. We will look at things like the F-Scan and Firefly, Molly's testing, which is the bioimmune meridian testing. We'll look at live blood analysis.
We need to look at everything. It all connects.
We're looking at so many different levels to this to try to figure out not only what the best treatment is for you, and that could be chemo, surgery, radiation, it could be low dose chemo, and trying to figure out, even if somebody had to do chemo, for example, which sometimes it's just a necessary evil, that we figure out what chemo agents might be the best based on the testing that shows the response in the cell, the cancer cells, to those chemo agents. So we can dial it in a little bit better. Just a couple examples there. All right, so once we do a lot of that testing, then we have to figure out the starve and the kill phase. Starving the cancer is repurposed drugs. These could be drugs like metformin that are glucose-lowering drugs. They could be antiparasitic drugs.
There's, I think, 2 or 3 on
Do a really good job. Mebendazole, fenbendazole, albendazole. There's a number of different antiparasitic drugs in the repurposed drug list that we could use. And to keep it simple, these drugs block certain pathways that, quote unquote, feed the cancer cell. I'm simplifying it, of course, but just for understanding, that's what the repurposed drugs will do. And then the kill phase can be chemo, surgery, radiation, low dose chemo, immunotherapies, and they're all in that conventional world, except for the low dose chemo we do here, right? Bring the insulin levels down, inject the chemo agents, infuse the chemo agents, I should say, from the testing. That's very specific to you. That lowering the blood sugar causes a vacuum effect in the cell because they're starving. So when you introduce the chemo, the cells, those cancer cells, suck it in like a vacuum, and it's targeted. So we use less. We can use less chemo, 10%, 15%, because of that targeted effect, and it tends to reduce the side effects significantly. So those are all options as far as killing the cancer. Pillar 3 would be things like immune boosting, right? Cancer, one of the hallmarks of cancer is a weakened immune system. So we want to go after the immune system and strengthen that any which way we can. Another hallmark is low oxygen. Another hallmark is high acidity, right? Another hallmark is low voltage, which we've done cancer conversations in the last couple months on that. And another is the nutrient levels get low. So if we can start addressing those things early on, we can change that cellular environment, which is just going to increase the chances of healing. Okay? And then pillar 4 are your causes, right? There has to be, in my opinion anyway, I've said this many times on the cancer conversation, I think cancer is a symptom. I don't think it's an actual diagnosis. I actually think it's a symptom of metabolic dysfunction, right? And I think there's a lot of people that would agree with that. So if we're seeing it as this dysfunction and a symptom, well, what causes it? And as you know, the conventional world really doesn't even
into that. They
touch
don't even,
causes. They want to kill the cell, which I totally respect, and I think it's necessary with most people, to be honest with you. However, they don't get into oxygenating, alkalizing, immune boosting. They don't get into the things
supporting the body, to make it so they can actually heal and not get this again. And they're just looking at
one aspect. I call it one chapter of a 20-chapter book, right? So as long as we're implementing these other 19 chapters, causes being one of those, we have a great shot. I'll use the term, mitigate the downside. It's all risk management, right? And I say this a lot, but I want a plan, no matter where or what, I want a plan that gives me the best chance to fight the fight. Okay? And then if I have that plan and we put all these things together, we have seen we have the beauty of seeing this day in and day out.
Every day.
We have seen really, really major turnarounds to a patient.
And it's the patients who are really spending the time to do all the testing, not really just picking and choosing, really trying to find everything whole body, what could be causing these, because it might not be one thing.
That's right.
It could be several things.
That's a great point. From a cause standpoint, you're looking at these antigens. The antigens are foreign invaders, could be bacteria, could be viruses, could be parasites, could be candida, could be heavy metals, could be toxins, could be non-metal toxins, mycotoxins from mold infection.
Yeah.
All of those are on the table for sure. And quite honestly, a lot of people have multiple.
I see it all the time. They have EBV, Lyme disease, parasites. It seems to all be kind of connected, or at least a lot of people have a lot of different exposure, mold disease. So it helps, or it kind of hurts to not look at everything, because you're leaving stuff on the table that really all need to be healed together.
And if it's a symptom and not a cause, these are the causes. So to keep it simple, and I'll explain this, what happens to the immune system when a parasite is introduced, right? But to keep it simple, if I have a lot of gasoline being dumped on a fire, the fire would be your inflammation in the body.
Yeah.
That inflammation, at the end of the day, and I'm skipping steps, is going to cause damage and what they call oxidative stress to the cell. That oxidative stress starts to damage DNA and genomes of the cell. The DNA and the genomes are designed to take the cell through apoptosis, or cell death. And again, I'm simplifying this, but if that occurs and we have enough of that inflammation, enough oxidative stress, and the damage to the DNA and the genomes, those cells no longer go through apoptosis, and those damaged and old cells replicate.
Right.
That's cancer. So if we go back up the chain of events, the inflammation is a big factor in this, right? So then you go over here and you say, okay, well, what are the causes of inflammation? It's everything we just mentioned, right? So with that, let's do a transition to parasites.
Right.
So one of the things that happens with parasites, and Ashley will kind of get into this a little bit, but it's especially worms, right? Helminths, right?
Yeah.
Roundworms, pinworms, hookworms, flukes, and Ashley will talk about that.
Yeah.
But these worms are multicellular organisms. They're big.
They're big. Yeah, you see them.
Yeah, and look, they could be microscopic as well. But the point is, when they're multicellular, the immune system reacts a little bit differently than, say, a single cell organism like a bacteria.
Right.
And so because it's big, toxins have to be released to kill it. Okay? So what happens is, these on the cells of these parasites are kind of receptors. And our cells, mast cells, eosinophils, basophils, are constantly looking for these things that are foreign.
Yeah.
And they look at the receptor and they go, that's not normal. And they start
That's an invader.
That's an invader. They start levying an attack. Now here's the kicker. These eosinophils, basophils, and mast cells all have something called granulocytes in them. I don't want to get too nerdy, but granulocytes, okay, are part of the toxic, effect on killing the parasite, and they release things. Yeah. So they release things like inflammatory cytokines. They release chemokines, they call it. They release histamine. They release things that are going to, in turn, and B cells, right? They're gonna. There's this B cell response that happens, which then triggers T cells, which are your attackers, to go attack. So there's a lot of things going on that the parasite needs to have happen in order to kill it. Okay, keeping it simple. The point I'll make with this is, when those cells start to attack, there's a lot of things released. Okay, and when I talk about cytokines, they're inflammatory proteins. When you talk about chemokines, they're inflammatory chemical agents. There's proteins like interleukin-4 and these B cells, and all of a sudden you're just attacking, releasing a lot of these cytokines and chemokines, right? Which then create symptoms. So I tried to keep that as simple as possible, but those symptoms could be what? Things like what?
It can be anything from neurological stuff. So that can be brain fog, that could be headaches, it could be irritability, depression, some of the common stuff that most people would associate. So gut stuff. abdominal pain, bloating, diarrhea, constipation. Teeth grinding is another one that a lot of people don't even realize are related to parasites.
Yep.
Then you have skin stuff. You can have hives, you can have eczema, itching. So really it can be multiple things.
And those symptoms come from that attack that I just talked about, and those mast cells and eosinophils and basophils releasing these granulocytes, which are basically the toxins that are trying to kill the cell.
Yeah.
But as a result, you get the extra inflammatory proteins and chemokines and things like that. Mucus is a big one that's produced, whether it's through the nasal passages or through the rectum, right? Through your fecal matter.
Yep.
You can have mucus. That's a sign that things are going on there. So
that's a good point.
Stuffy nose, nasally, just to parallel some of the things that you were talking about. Headaches are a big one. Joint pain, fatigue. They're all a part of this overactive immune response and sensitivity reaction. And histamines are a big one. So patients have probably heard of this mast cell activation, or too much mast cell activation. That could be parasites. And I think more and more as you read and learn, there's a lot of practitioners that think parasites are a big, big factor in cancer.
Yeah, I've heard it definitely more and more. And I think that as time goes and we get more information, patients are really a lot with the liver too, the certain parasites that like to be in the liver more.
The flukes,
they're wondering, is that really that lesion is a parasite? They're trying to really pinpoint the two together. And I think that most cancer patients that I scan have parasites.
Yeah, I think it's way more common today, and we'll get into why, because there's definitely reasons why that is. I think gut vulnerability, stress, makes a big a lot
of risk factors.
It's a lot. There's a lot of risk factors. I think stress is a major one.
Yeah,
and I think also the foods that we eat, of course, and what we consume, and we will go over that for sure.
Yeah.
So let me pull up the slideshow and make sure that we go through everything so you can see what we're seeing. I did want to just give you an insight on a little bit of the immunology, simply because when we're talking about cancer, right, or a chronic disease, when you have enough of that fuel to the fire, the mast cell, the basophils, the eosinophils, and all those chemicals that are released, that is going to create massive amounts of inflammation.
Yeah.
And the inflammation is then what damages the cell and the DNA and the genome. So again, anything like that that's sitting in the system that's creating that response, it's going to cause damage and oxidative stress to the cell.
Yeah.
It's a big deal, right? And to your point, there are, and I'll show you a video, Dr. Carlton sent me this today, knowing we were doing this.
Yeah.
Just recently, there was a neurosurgeon that did a surgery on a tumor in the brain.
Yes.
And it turned out to be a parasite, and he showed the parasite. I have the video, I'm going to show you. But that's what we're seeing. It just happened to be coincidental, but that's what we're seeing, more and more of. So anyway, without further ado, so myself, Ashley, are doing this. You don't need to know about me, but I'm going to let Ashley kind of introduce herself and tell you her experience here.
Yeah, so I'm Ashley. I'm one of the technicians here. I've been here about 5.5 years. I've had a few roles over the years. So if you've been to the clinic in person, we've probably met. So currently I'm doing the F-Scan and Firefly, which we're going to get into in today's episode. It is testing and treatment for parasites. And then also we do it for other things as well, but what today's topic is mostly going to be is the parasites. So we'll get into that.
Yep. Okay, so center, a lot of you know about the center. I'll go through a little bit of that if we have time at the end, but I want to get going on the parasites so you learn a little bit here.
Yeah. So why should I learn about parasites? So we have come to realize that almost everybody has parasites. No matter what the numbers show in CDC, I think through integrative testing, we've seen it in our clinic that almost everybody we test has parasites. So over 1 billion people worldwide are infected with parasites. Most people don't even know they have parasites. We did mention there's a lot of symptoms that you can have. There's definitely kinds that don't have symptoms, or again, they're just not relating it to possibly parasites. They might think it's hormones or something else.
Yep, correct.
They are damaging on the body, so they can invade our nervous system, our brain, our spinal cord. It's not always just in the GI system, so that obviously can cause huge havoc on the body. And testing is really, really easy. So we definitely want to take advantage of the technology that's out there. Parasites can take from our nutrition. We spend a lot of money, right, on vitamins, and we take time to get our IVs and all these things that are really nourishing for our body. We want to make sure that these parasites aren't taking that from us. So lots of good, important reasons to know why, if you have a parasite or not.
And I know we'll go into it a little bit from a testing standpoint, but I do want to mention even my personal experience. We were in probably 15, 20 years ago, before I really got in heavily to all this. We were in another country, came back, had stomach issues for about 2 weeks. As a man, you're just as a person, sometimes you're like, it'll go away, right? It'll go away. My mentality is always like, I don't need to go anywhere. I'll go away. It'll go away. It didn't. So I went to the urgent care. And I remember the doctor saying, he said, don't be surprised. We rarely find anything.
Yeah.
I'm like, well, I definitely know I have something. And then so the test came back, didn't show anything, gave me some just standard med, and it went away in about a day or two, right? Yeah. The point I'll make is when I went back, as I learned this, I went back and looked at what they tested. They only tested 4 things. So there was literally 4 things on the test. And I'm thinking, how many protozoa, which we'll talk about, or how many helminths worms are actually out there?
Right.
And they're only testing 4 major things. And so, of course, they didn't find anything.
At least 100, if not more.
It's not that I didn't have it. They didn't find it.
Right.
So that really cued me in on the more elaborate testing and going down the road of why some testing misses.
Right.
And we'll talk a little bit about that.
I hear that all the time. I've tested before, but I was negative. Well, what test did you do? It might not have been really a detailed or in-depth test.
Exactly. So we'll talk a little bit about that too. But sorry, didn't mean to interrupt.
So what is a parasite? A parasite is an organism that lives either in or on another species. That's known as the host, in which it can feed off of you. So there are 3 main types of parasites. We have the first one, the protozoa. So that's a single cell that can multiply and divide within the host. So that one can cause a lot of the symptoms that we talked about. Yep. This is usually transmitted person to person through a fecal matter, blood, or insect bites. I know this one can also come from food or water, but those are kind of the main ones. Some of the examples I know are Giardia, toxoplasma. You can get malaria and things from protozoa. So it's really important to make sure that when you're getting tested, you are getting tested for all 3 categories.
Yeah. So the protozoa is one of them.
Then we have the helminths. This is the one that people are probably most familiar with. These are going to be your worms, your roundworm, your flatworm, the flukes. These are ones that are usually going to pierce through and attach to the GI wall. So these are ones that really burrow into the GI system.
Now, having said that, so good antidote. When we do stool ecologies, sometimes it doesn't even show up on stool ecologies because if they're burrowed up in the intestinal wall, the stool's coming through the colon and it doesn't attach.
It doesn't get it.
So that's a real caveat to all this. So sometimes multiple stool, other than the F-Scan and the Firefly, multiple stool ecologies around the full moon, a couple days before, during, and after. And it's known that parasites are affected by the gravitational pull, right? And so if we can do that, get them out, because I know it's a little disgusting, but from what I understand, they lay eggs around the full moon. Is that correct?
Yeah, they're definitely more active, as you mentioned, the pull, and then also we make serotonin. So they're feeding, they're hungry then. So that's when they're laying their eggs. Another point is people ask me all the time, how come they didn't see it in my colonoscopy?
Yeah.
Well, if they're up and in the walls and kind of in hibernation outside the full moon, chances are they're not going to see it.
And so that's where the stool ecologies we have a rough time. And I'll be honest, I've run probably hundreds and hundreds and hundreds of stool ecologies over the time. I've had some, but not many, and they have ton of symptoms. Then we send them to you or Molly or some of the other modalities that we have from a testing standpoint. and they come up, we work that through their system as far as the protocols,
Right.
they start doing great.
Right.
So it's kind of like where there's smoke, there's fire. Sometimes you have to use other means to be able to identify these. So I did want to mention that.
Yep. The last class is called ectoparasites. So these are multi-cell organisms that either live on or feed off of the skin, or the blood of the host. So these are going to be your fleas, ticks, mites, mosquitoes, lice, scabies. I think a lot of people don't even realize that these are a class of parasites.
Yep.
Those can be transmitted through blood or just through being on the skin and biting us.
And then, of course, the ticks, right?
Right.
You get the Lyme. So that's a biggie. All right. You might not be able to see the wording really, really well, but we already went over a lot of the symptoms, but this just gives you another visual of what symptoms, patients could have when they have parasites. But it's autoimmune type of symptoms.
Right.
It's the fatigue, it's the pain, joint pain. It could be the headaches, and then of course, vomiting and itching and
some of the
diarrhea and bloating and gas and just intestinal disruption is a big one. And like you said, the brain gets affected quite a bit by these parasites as well.
Yeah.
But from what I understand, and you mentioned it, like anxiety and nervousness are big too.
Yeah.
That could be related to parasites.
And we ask people during a full moon, do you have more of those symptoms? It's interesting. You see those symptoms actually rise.
Yep.
And also we didn't mention anemia. That's one sometimes the doctors, they can't figure out why the patient's anemic. They've done other testing and it just isn't, they're not getting answers. So that's another kind of big one, at least to rule out.
Now that wouldn't be a bleed thing, would it?
They can be actually taking from the blood.
Yeah. Okay. That's interesting, right?
Yep.
It's a little scary, right?
I know.
All right. So I think symptom-wise, I think we've covered a lot of those, but I'm telling you, a lot of things from a symptom standpoint are on the table, right? So we can't discount a parasite and some of these symptoms. So we look at it with everybody. Let's put it that way.
Yeah, absolutely.
Okay.
Then we have the risk factors. So although we're all at risk, there's definitely some risk factors that can make you more likely to get an infection or for you to have the parasite and be really symptomatic. Some of the risk factors for getting parasites are antibiotics. So that obviously can cause havoc on the gut. Sometimes it's needed, but that can put you at risk. Poor sleeping habits. We really need to get good sleep for our immune system to work properly. They're happy when we're not sleeping. That's another reason why they're really happy at the full moon. We actually make less melatonin. So that's a good environment for them. Poor dietary habits. So if we're eating a lot of sugar, a lot of processed foods, foods they like, and then obviously we'll get into some of the ways that you can get it if you're eating foods that haven't been cooked properly. Maybe no organic foods. Chronic stress. We all know how detrimental stress can be on our body. So with increased stress, you are at more risk for an infection. And then major traumas or injuries.
So real quick on the stress part of it and the gut. So you have a couple factors there. Number one, when we have stress, your digestive system should be under what they call parasympathetic rule, which means it's rest and digest. When you have too much stress, it's on sympathetic overdrive, which is fight or flight. That creates in the stomach, they call it the nervous stomach, if you will, but that changes the microbiome. It changes the acidity levels. It changes a lot of different things within the gut. And it also is an immune, it weakens the immune system. So between the gut breaking down and a weakened immune system, it's just setting the table, honestly, for a parasite to thrive. Because ultimately we're exposed to these things. We should be able to kill it, right? If we have the right system.
Stomach acid, if our system is in good health and we're sleeping and don't have stress, we should be able to get the parasite, but it not necessarily turn into a big infection or have all these symptoms.
And I think if we really nail it down as to why we're seeing the increase, it is because of all of it. It's the foods. It's the stress, it's the lack of gut health and just general overall health of the public in general, which is allowing an environment that's way more conducive than years ago.
We're all stressed. We're in a hurry, so we're just grabbing food that might not necessarily be the best for us. A few other factors that are just here at the bottom. Owning pets. From what I've seen in my testing, I feel like most of the parasites I'm seeing are from food, are from travel, from water, but pets is a way that you can get parasites, obviously traveling to third world countries, and then not washing your produce. I think that's a really big one. I think people don't realize how much can actually be on our produce, our vegetables. So there's
even the organic, probably a little bit more, because they don't put a lot of the stuff on it to kill this stuff off. So if you're buying organic, which we totally recommend, you want to make sure you're diligent about washing.
I get that a lot. And sometimes it'll say, already washed. I recommend people wash it anyways, because you just never know if anybody has been after it's been washed, and you don't know how they're washing. So I think that no matter what, you should always wash.
Yep. Agree.
Okay, so these are some of the tips for a successful parasite cleanse, and then optimal treatments. So there's a few different ways you can test for parasites. The first one is a comprehensive stool test. So this is usually beyond just sending a little sample to LabCorp request. This is really looking at all of the gut, because as Dr. Roney's talked about, it's not always just the parasite. We really need to see what else is going on in the gut, but it is going to check more parasites. As he mentioned, when he went to ER urgent care, they only checked 4.
It was a LabCorp test, which is fine. It's not, because we work very well with LabCorp. But one of their tests was the one that the doctor ordered, which was only 4
Probably
different
ova
things.
And parasite.
It's exactly what it was.
And that only includes a small amount. So we want to make sure we're doing the correct stool test. And we have plenty here. The doctor will decide what's the best one for you. That's going to check a lot more parasites. But sometimes that even comes back to where the parasite was dead before it got to the lab. Or as we mentioned, it can hide in the wall of the intestine. So maybe it didn't come out of that stool sample. So we have other options. And sometimes it's doing a combination of all of them.
That's personally what I think we should be doing, especially if we're trying to identify parasites, even candidas. Let's do a combination of different things that could give us that answer.
When we're testing for cancer, we don't use just one test. We look at multiple things. So what we might find in the stool might show something different on your energetic testing. And that's okay, because they're all using different ways of testing. So then we have the energetic biofeedback testing. That's really good at looking for parasites and what are the best supplements and prescriptions if needed. What your body is asking for supplement-wise. So there's a lot of different supplements out there. It's going to tell us my body is really responding well to this medication or to this supplement. Then we're not just guessing, because there's a few different options out there.
Yeah, it's kind of like a lot of you are familiar with muscle testing. Kinesiology, applied kinesiology. We just have machines that can do that for us.
Do it, and you get a nice printout so you can see it, and then it's not somebody doing it manually, which is great too. A lot of doctors do that, but now we have machines that kind of do it for us, and it's quick.
It's trying, again, not cookie cutter, but more specific to you, your cells, your body, etc. So
then we have the F-Scan. That's the test that I personally do. That is taking frequency and bioenergetic testing. So what it's doing is there's a database of a bunch of different frequencies, and we're checking which one your body is bioenergetically responding to. And each one of those frequencies is linked to a different parasite. So I think we have another slide that will go into more detail.
For sure.
Then we check for underlying conditions. So a lot of times parasites and candida go hand in hand, and it's really hard to get rid of parasites if you're not treating the candida, or we're going to have a lot of die-off if there's candida there, and heavy metals. So they all kind of go together. We want to make sure that we're looking at.
And I know Molly and Keneally, and they're big, especially Molly. She's big based on her training. We need to get rid of the candida and the heavy metals because, from what I understand, they feed the parasites. They love it. They love it. So, so getting rid of those typically before we start a parasite cleanse is the cadence. And sometimes, say you have these 3 things. You have heavy metal, candida, and parasites. The cadence does matter. Meaning what you do, it does matter. So you could have the answers, but the wrong cadence and still get the wrong outcome.
So you need the guidance of what order to go. If you're killing off the candida and the heavy metals first, those parasites are going to get a lot weaker. You may even be able to get some of that out of your body just from
naturally from doing those 2 things.
You're boosting your immune system and you're making them weaker. Then you're going to begin the anti-parasitic protocols. So that's going to be cleanses, Detox, sometimes that's going to be detox baths. There's a few different ways that we detox, because again, you're going to want to detox the heavy metals and the candida. But for parasites, we have what's called a full moon kit, which we'll show that in another slide as well. That's a really nice cell core supplement that kind of supports the whole process of detox. And then we have garlic. You can do that in an enema or orally. And then we have berberine is another great product. And then treatments, and the detox and the oral protocols can go along with the Firefly and biocharger treatments. Sometimes people will only do one or the other. That's kind of up to the doctor. For whatever reason, they may think that they're a better candidate for just the supplements. Maybe they have a health condition that you can't do the Firefly, or maybe they can't do the supplement. So sometimes it's going to be a little different per patient. And
that's why that's Keneally's mentality of designing this clinic was, not everything is right for every person. So we want enough tools in the toolbox with one diagnosis to be able to treat. A lot of people come here along those lines. They come here for natural care. Right. And sometimes I even, over my years, doing things like the Firefly, I think is definitely a really strong part of this plan. But then also maybe doing a little bit of the medications as well, because sometimes they're overrun. The person's overrun with enough of these that we need the heavy hitters. And then of course, if we're working on the gut, we're working on just their overall health. The meds, always a downside, but we're mitigating the downside of the medication, but getting rid of these things quicker too.
Especially someone who's really symptomatic. If you don't really have any of the symptoms, you might have a little bit more time. But some people are very symptomatic, so they need to get kind of those heavy hitters. The
heavy hitters, It's kind of like the chemo analogy with cancer. Sometimes things come in and they're really, really aggressive, and we're like, hey, probably a good idea to do this, but as long as we're doing all this as well, you're going to get the best of both worlds.
Absolutely.
So just a good analogy.
Yeah, and something we kind of quickly mentioned earlier. So parasites in the full moon. So some people always kind of find that a little voodoo or a myth, but it is actually scientifically proven. So full moon does create these lunar cycles, which actually influence the overall health of our body and what's going on. We are making more serotonin at the full moon, less melatonin, and the parasites love that. They like to feed off of the serotonin. They can actually reproduce and move around the body. So one thing we didn't kind of talk about is parasites can move from the gut to the liver, into, some doctors believe, the kidneys. And so when
brain.
Brain,
connective tissue.
So during that time of increased serotonin, they're more likely to do that. So a good time to treat is the full moon. Obviously, if you're symptomatic throughout the month, we're not going to ever just say, nope, we have to wait. But if you can do it during the full moon, they are more active at that time. So you have a better chance of attacking them. Especially because it can be hard. They hide. So that's when they're kind of out of their burrow mode.
And briefly, they hide. They're very adaptive, and that's been proven. They also create a biofilm around them, which protects them. Candida does that as well. So when you're doing some of these things and some of these protocols also go after the biofilm, break that protective layer down, and then allow more accessibility to killing the cells.
That's kind of like their blanket. They can kind of hide under that. So once you can clear that out, you have a much better chance of actually expelling the parasites.
There's definitely a method to the madness for sure.
All right, this is a picture of some F-scans that I've done on patients. So you see each one looks a little bit different. The first one we have here is that the right or the left side for the patients. This one was a patient who was eating a lot of sushi. So these probably look like just a bunch of crazy words. But what we're actually seeing is a lot of liver flukes. And a lot of liver flukes usually come from fish. So the patient was pretty shocked about how many she had. Even though she was symptomatic, she still didn't really kind of correlate sushi to parasites. So this was one that she had a bunch of kind of the same type, like all the cousins to each other.
That point back to fish, a lot of,
Yep. There's a pancreatic fluke on here. There's an intestinal fluke, liver fluke. So that was an example of one where she had a lot of parasites.
Yep. And just briefly, there was a doctor here for a long time that said, hey, if you have some things going on, spots in the liver that aren't potentially cancerous, but that are there. She said she believed that almost 100% it was some type of fluke, liver fluke.
Yeah.
And
Yeah.
the F-scan typically would correlate with that.
Yeah.
So,
And I see a lot of flukes in the cancer patients.
Yeah.
I think the cancer patients are actually sometimes relieved. They're like, okay, this kind of explains and kind of gives them some answers.
Exactly.
Then we have a few other ones here. The one up here, this one had a lot of well, not a lot, but it had some bacteria. So this is just an example. I know we're talking more about parasites today, but it can actually show some bacterias. So you can see the ones in the green are going to be your positives. The ones in the brown and the red are going to be your negatives.
So all these were heavy positive.
Yes.
Then what's the darker green?
Yep, you start
sort
to
of
get, yeah, so not to get too technical, but what it does is it is actually putting the frequency into the body, and it's checking your body's skin resistance. The hertz that it found or it matched is getting further and further away.
Gotcha.
So it's almost like a less positive.
These are dead on.
These are like
these are moving away, and you're like, yeah, probably not.
Right. So we start with the bright green, the most important. It's kind of like peeling an onion sometimes. You kind of want to go through the layers. We want to get to the most important. And sometimes if we can kill off the top ones, the immune system is going to start working better, and the body can actually kind of fight off these other ones on its own, or the supplements.
The lower amount of things that the immune system has to work on, the stronger it will be to be able to fight.
Right.
Okay, so then you have this one here.
Yep, we have this one here. This one actually had, I think, a Protonza on there, so a protozoa, excuse me, and some Candida. That was one where a patient did actually show Candida on here. So we're able to actually do multiple types of organisms on here, as long as they all come up on one thing. So this patient, we treated parasites, we treated Candida, and we did some bacteria.
So I guess categorically, there's the worms, the protozoa, the single-celled organisms, bacteria, a lot of bacteria on here. How about viruses?
It has a few viruses, mycoplasma. It has some herpes simplex 1 and 2. It has a few. I get asked a lot about Lyme. It has Epstein.
Okay, good. That's a good one. I honestly, I didn't know it did viruses as well. So I'm learning something too.
Yeah.
Because then I can refer the patients over. Hey, go get a quick check and see if you have any of these going on in your system. Now, again, we could always do blood too and follow up with that. That's fine. But but it's a good like, hey,
it's a good quick tool. I actually had one of the employees was having a really bad stomach ache the other day. And she's like, this is quick. Can I do it? And she thought she had a parasite, but it actually came up with H. pylori.
Oh.
And I said, let's just do the blood test just to confirm you're here. It came up. So sometimes that quick check really can.
We do see it correlate, by the way. This is where it's in when I first got here, we had a lot of these energy tests, and I was very more scientific, where I wanted to see it. I wanted to see blood. I wanted to see urine.
Yeah.
But then when we do this and then we check it, so many things correlate. Matter of fact, it correlates way, way, way more than it doesn't. So then you just go, okay,
Let's
energy,
just do it.
the energy and the frequencies, just like cells have energy and a frequency.
Yeah.
Organisms have energy and frequency. As long as we could find it with a tool like this, and then I know you're going to go over how to kill it, but we'll do that next.
One other thing to mention, if you do have a patient or any of the other, physicians, and it's something that's not on here, but you want it to be treated, we could always make a custom protocol as long as there's a frequency for it. So if someone's done here's my stool test, it found it, we can treat it.
Yeah, and so the frequency has to be in there.
As long as it's in our database.
Yeah, that's right. Okay. All right. Good to know. Good to know. And we'll talk a little bit about that, because the Firefly is the treatment part of it. So go ahead, I'll let you.
Yeah, so they're usually scheduled together. Both are quick, so it's really easy to get both done in the same day. This is the Firefly treatment. So this is by Bales Photonics. It's a combination of light and frequency. So basically it's using the power of wavelengths of light, and the machine is emitting the frequencies through the light. So there's Rife frequencies and a lot of different Rife machines out there. The difference, or what makes this so powerful, is these lights are extremely strong. So they can penetrate up to 8 inches into the body.
Oh, wow.
So people are, how do I know it's actually getting into my liver, into my intestines? Geez. It's going really, really deep.
Okay.
We use Firefly for a few different things. It's mentioned on the the screen here, inflammation, ATP. We can do it for lymphatic drainage. We can do it for wound healing. I would say I mostly do it for pathogens because we have so many frequencies of different pathogens. It's a great tool. So that is an example. So you can see in the picture, we have the two little handheld devices that are going to go over the gut. We sometimes do the head. We sometimes do the kidneys if the doctor thinks for some reason that those symptoms need to be treated directly. A lot of times if you're healing the gut, it's going to heal the other areas too, like the rashes, but we can definitely put those wands over any part of the body.
Okay. All right. And so just to give it, because you mentioned Rife technology, right? So the way I understand Rife technology is Dr. Rife years ago.
Yep.
Basically,
like 1920.
Yeah, long time
ago.
Long time. And actually did a really good job when you researched this. But he basically, if you're not familiar, he found organisms under a microscope, right? And then he found what their frequency was.
Right.
He mapped it out. And his database was extensive.
Yeah.
And then he created the frequency with a tool that matched the frequency. And it's kind of like the way it's explained to me, and I'll have you verify this, is like if you watch, there was a commercial where a lady was singing really loud.
Yes.
The vibration and the frequency cracked the glass.
Right. So if you have the one frequency and you put the same frequency next to it, the two vibrations together are going to break apart.
That's what kills. That's what kills it. And that, if I'm not mistaken, for the audience, because I'm even curious, that's the way the Firefly basically works, right?
Exactly.
That's exactly right.
That's exactly how it works. Yeah, I think there's even ultrasound technology out there that can break apart kidney stones by putting certain wavelengths. So it's not something that we've created here. It's actually old technology.
Right.
So that's why it's so important to test on the the F-Scan, because you need to have the right frequency. If I take a frequency for another parasite and try to kill a fluke, it's not going to work.
Right?
Yeah, it's not going to have that vibration.
To match. And that, so the F-Scan is what finds it.
Yeah.
And then the Firefly is what matches that frequency. So is it, and I'm getting a little nerdy here because it's pretty exciting. So is there a mechanism where you can adjust, this is a silly question, but you adjust the frequencies on this?
So the machine will take the F-Scan and automatically transmit it to the Firefly, and it's going to go through the different frequencies one at a time. So it goes for 10 minutes. So if you have 10 different parasites, you're going to get 1 minute per thing. So you can do multiple at a time, but it is going to go
kind of automated.
Yeah.
Okay.
Yeah.
That's great.
It's very smart. So there's not really any error. It's all going to be automatically transmitted. And then the Firefly itself is built in with it's called sideband frequencies. So say I'm treating the fluke, if there happens to be any other frequency or thing with a similar nearby frequency, it's going to attack those too.
Yeah, that's great.
It has about 1,000 different sideband frequencies. So there's more in there than we even realize.
So so you have the database, but then you could be simultaneously killing other things if the frequency is similar.
And I've had patients tell me that, I tested for fluke, but I actually end up also passing, something that looks a little bit different. Yeah, probably one of those sideband frequencies.
It's pretty cool.
Worked. Yeah.
Yeah, it's pretty cool. And real quick, you mentioned Dr. Bales.
Yes.
So Dr. Bales was here with us. His father is, if I'm not mistaken, he's the one that invented the technology for thermography.
I think the first digital thermography.
Thermography. So they're smart. They sit in they're in their garage literally making stuff like this. So I trust them because the level of intelligence I know is extremely high. But then you use it and patients come back and look what I passed. They show you and I'm such a nerd. I'm like, I want to see it.
Let's go. I could talk to him for days. So he's an engineer and then went and got a PhD and became a doctor of acupuncture and oriental medicine. So he really kind of put his love for the two together and said, hey, I can do stuff with my light machine and I can do frequency. Why not put the 2 and 2 together?
Works well.
Yeah.
Okay. Biocharger.
So Biocharger, this is another machine we have in the office. And I think they both work great together. You can do one, you can do the other, you can do both. Biocharger uses light, voltage, frequency, harmonics, and PEMF. So this is one, if you haven't been in it before, where we can treat multiple patients at a time. And it's doing a few different kind of technologies. So it has pre-made recipes. So it's a little more general treating. but you are getting whole body. So that's kind of a benefit, that the Firefly is more set to one area. That could be a pro or a con.
Yeah.
So both are great options. We've had patients that have come back and said, I passed a Parasite with either one.
There's multiple, this can be set to multiple different, what do they have? What's the word I'm looking for? Yeah, recipes, if you will. So it can be set, but to Ashley's point, the Firefly is very specific to a parasite that has been tested and frequency derived and then treated with that frequency to basically vibrate and kill. This is a little bit more general. Still, from the research, does really, really well. But again, that's where I think, you know, if you did a little bit of yours or did yours, the Firefly F-Scan, and then did some biocharger, and then who knows, like, parasites are really hard to get rid of.
Right, they're tricky.
They're tricky. So if you're doing those things, and then we'll talk about supplements, I'll talk about the meds, and we'll go down that path of when to use what.
Right.
And kind of give you a little bit better insight there.
Right. Again, the more tools in the toolbox, the better you have a chance of actually getting rid of all of these. So they're all great options.
For sure.
This is different products that we have here. There's a lot of different products out there. All the products that we use have been vetted. We've tried them. We've had them for a while. So this is the Para Kit, the Full Moon Kit by Cellcore. So we brought this into the clinic a few years ago. This one is quite popular.
Very popular.
I've seen a lot of other naturopaths and different doctors use it too. It's probably the #1 kind of product out there. What's nice is it has 4 products. So it's not doing just parasites. It's cleaning up the gut. There's what they call the scrubber.
Yep.
Then it also comes with a binder. So that way you're not having as much die-off reaction. So it's kind of a little bit more of an advanced treatment. And even though it is called the Full Moon Kit, you actually can take it daily. But as we've talked about, since parasites are most active at the full moon, that's kind of our timeline of when we usually treat.
So this kit, if I was doing it around the full moon, when do I start it? When do I stop it? How many days is that worth?
Right. That's a great question. There's actually instructions for 3 different
kits?
So it's all one kit, but they have instructions for beginner.
Yeah, right.
Somebody who has never done a cleanse before, has never treated parasites, maybe has never done lymphatics, so they might not necessarily be ready for a big flush. That you start 1 day before the full moon, day of full moon, day after.
Yep.
And the dosage is less. You're taking less per day.
Yep.
The same products, but less. Then you have intermediate. That's your typical patient. A lot of our patients here who are treating are doing lymphatics. It's just kind of part of our program.
Right.
Whether it's dry brushing at home, doing lymphatic massage. So a lot of people can start this one and kind of surpass the beginner. That one you're starting 3 days before the full moon. 2 days before the full moon.
Yep.
Day of and then 2 days after. So 5 days total. Then you kind of double the amount that you were doing in beginner. And then there's the advanced.
Right.
Yeah. And that's for 7 days. And the most instructions. Some people will try to do advanced, and you could always back down if you decide that that's a little too strong, or you said, you know what, I did beginner this month. I think I can handle intermediate. You can always increase for the next month. So the goal is to do it for a few months in a row, because you really want to get all of the life cycle of the parasite.
Good explanation. And I think the advanced one would use all of these, I think, right?
Yeah.
And then you have leftover if you're doing the beginner and the intermediate for the next month.
Right.
So you might be able to get a couple months, especially out of the beginner.
Yeah, beginner I think is about 5 or 6 months, because intermediate is about 3 months.
Okay.
So we try to at least do it for 3 months. So the intermediate is nice because it gives you enough. But obviously, if beginner is a little bit more appropriate, if you're someone who's really sensitive.
Sure.
We have some people who have detox, but they have, again, Lyme and all these other things, and they're just a sensitive person.
Definitely.
It just might take them a little bit longer.
Yeah, it's just prescribed accordingly.
Yep. Then this is the Fluke Proto Release. This is actually one that Dr. Keneally formulated. It's a Center for New Medicine product. It's got a little bit different ingredients in it. This is one that's taken daily. I think the main ingredient in this one is black walnut, which is a popular one. And then it actually, I think, has some Chinese herbs. So this is a good one too. You're just not going to get the binder and different things with it. So you might need to have a few other supportive supplements with it, which Dr. Roney prescribes a lot of gut things that they may already be taking. So maybe the para one is more than they need because they're already on digestive things. And
we're making sure we're giving them I think the biofilm is a big deal,
Right.
which the
Yeah.
full moon has some of
Yeah.
that in it. But
Yeah.
breaking down the biofilm, the binder is designed that when you are killing off, you need to get them bound,
Yes.
almost like a magnet,
Yes.
and
Yes.
out. And if not, sometimes that creates a little bit more of an overactive immune response.
Yeah.
And we can get Herxheimer reactions, which is just, it's the immune system just basically reacting
Right.
to
It's
these.
not a bad thing, but it doesn't feel good.
No, exactly.
Right,
So we're
right.
trying to do everything we can, A, to allow the supplements to kill the parasites, and then B, allow the body to get rid of them without having a major reaction.
Yeah.
So there is a, I would call it a optimal way to do it.
Sure.
I think that full moon kit does a really good job, but then I might use with my patients sometimes the full moon kit with some of the fluke supplements.
Right. Maybe
If they have
outside of the full moon, this could be their their daily or whatever you're using. Mm-hmm. Then we have berberine. I think this one's on here because it's blocking some of the sugar, and parasites are feeding off of sugar. You might know a little bit more about this one in parasites.
Yeah, it could definitely, I mean, berberine's good for a number of different things.
Yeah.
It's good for reducing sugar. It is an anti-parasitic. It can kill microbes like bacteria and things like that, just because of some of the ingredients in it. So we use it for multiple things. So it's a good one that sometimes I'll put in if I think they need a little extra juice. But I use it honestly a lot for blood sugar control. That's personally what I use it for.
Yeah.
But I know there's a lot of providers that use berberine along with some of these other things too. And it does help. And oregano oil and things like that are really, really good too. So there's a ton of things for sure. So as we're wrapping, before we wrap it up, we're definitely going to take some questions. I was just thinking from a standpoint of when and what, right? So a lot of times this testing, yours included with say Molly's, and we're getting a better idea, even stool, right?
Yeah.
There's the gut zoomer from Vibrant Wellness I like to use. That's pretty thorough.
Yeah.
That's one of the most thorough. I might use the GI map. I might use Genova. It just depends.
Yeah.
But when we're finding like, ooh, the symptoms are really bad and it's correlating on paper or the scans, we may recommend the medication as well.
Yeah.
So we would recommend for sure the F-Scan Firefly. We might recommend the Biocharge, or we might recommend some of the supplements. But my opinion sometimes too is if they're really symptomatic and we want to just check that off the list, that's when the medications can come into play.
Right.
So there's things like menbendazole.
Yeah.
There's albendazole. There is Alinea. There's ivermectin. There's a number of different things that we can go after the nervous system of the parasite, the digestive system of the parasite. We can paralyze it.
Yes.
It can go after the larvae stage. So sometimes, just like again, the parallel is with cancer care.
Yeah.
Sometimes, aggressive needs aggressive.
Right.
And so we may do that in conjunction with some of these others as well. And it's up to the clinician as they gather all this data to kind of pick and choose what they think the patient needs.
Yeah.
Right.
Sometimes I see actually patients that are patients already treating, they're already on those medications because they're repurposed drugs too. So sometimes we don't even need to add in extra stuff because it's part of their protocol. Yeah.
Somebody asked me, well, because the repurposed drugs again are the drugs that can starve the cancer, but it has a dual role, right?
Right.
Sometimes the cancer is a result, could be, I should say. Yeah. Let me make sure I say that. Could be a result of the parasite. So you're actually killing two birds with one stone.
Yeah.
Right? So you're knocking down, you're starving the cancer cell, but you're also killing off any parasites that are there, which is a great thing if it's a major cause.
Right.
So
good
dual role.
Yeah. Yeah.
If
it's the right medication.
Exactly right. And that's where the testing can really dial us in quite a bit. So, okay, so we'll do as many of these questions as we can. Can the testing and treatment kill methane SIBO and hydrogen SIBO? These yours?
It's not going to do a test. There's not one specific
like for
frequency.
Bacteria.
If we knew what bacteria was causing the SIBO, then I could treat.
Sure.
But the testings would be a little, I think the best way obviously is the breath.
Yep.
But there's not a specific SIBO frequency.
Okay. Yeah. And real quick, SIBO is pretty tricky as well. I'll just touch base on that quickly. there are good protocols, whether it's conventional or even in our world,
Yeah.
the integrative world, for SIBO. What I find is people kill off SIBO, but then they don't get the gut right. Just like the parasite analogy, you have to get the gut right. And there's an ileocecal valve that is not working well, which allows for bacteria to translocate from the large intestine into the small intestine. And when it's there, those will feed off of starches especially and create these gases. So we could kill those off, right? But we have to, that's ileocecal valve is a big deal. That could be a thyroid issue. It could be a vagus nerve issue, usually vagus nerve. The enteric nervous system is low functioning for a number of different reasons. But just real quick, gargling, humming, singing loudly, gag reflex, things like that are really good for that ileocecal valve. That's just a little extra juice there. All right, ivermectin for parasites and when to use.
Yeah,
I think it's a great tool. I'm not sure isolated.
Yeah.
Right. It's a med that's used overseas consistently for very specific reasons.
So it depends on what parasite you have.
Exactly.
It's not one that just covers all parasites. So we do use it sometimes, but it's got to be one that is probably tested on mollies and it fits with the parasite that you have.
Exactly. All right. Can this, let's see, we did that. Favorite HCl supplements?
Zypan?
Yeah, there's Zypan from Standard Process. I personally like one from Apex called HCl Prozyme. We have that here at the store. The HCl Prozyme has the hydrochloric acid, betaine HCl, has all your digestive enzymes, has things like bile salts or ox bile for fat emulsification, especially if somebody has poor gallbladder function. I like that one personally, but there's with Digestime from Standard Process, Zypan, Multigest, Digest. Yeah, there's a lot of, but the HCl Prozyme is my favorite.
Yeah.
What test needs to be done to find out parasites? So the F-Scan,
F-Scan, Bioimmune,
stool testing are probably the big three. Will the recording be provided, Shep? That's a yes.
Yes.
That's definitely yes. Okay, so let's see.
Parasites in the nasal cavity, how to test and how to treat.
Yeah, good question.
Good question.
Yeah, so, oh man.
I think that's more symptom based.
Yeah.
Because it seems like when we test, whether it's from F-Scan, stool, or Molly's testing, it's all gut based. And I don't know if there's really a way to tell other than symptoms. Maybe you can think about that of where it is in other places. I know on the Firefly, I've treated the face, I've treated the mouth, I've treated the head.
Right.
Treatment wise, we can do that. And Biocharger is getting the whole body.
And I know there's flushes and sprays and things like that that we could.
And different,
if we know or suspect that they're there, we definitely could do. Silver's a great one. I might even nebulize hydrogen peroxide.
Yeah.
What's that? Megaspore is usually probiotic based, but I don't know about nasal cavity. But yeah, I mean, nebulizing would be one of the best treatments with silvers and hydrogen peroxides and things like that. But I'd have to think about that because we might be able to nebulize some stronger stuff in the nasal cavity. I know mold is big in the nasal cavity, but parasites I'm not that familiar with, but I'm going to do a little due diligence on that. What do you feel about diatomaceous earth? Yeah, I love it.
Absolutely.
I think wonderful. Definitely.
Yep. We carry that here. It's not one that we had on our slide, but I've seen it prescribed by the doctors and it's pretty affordable. Yeah,
I think it's a really good thing to use. Again, within a protocol, right?
Yeah.
All right. So let's see. When testing, can you take anything to provoke to get more accurate results? It's a good question. Kind of like if you're thinking of the heavy metal provocative test, something like that.
Right, like a chelating factor, right? When you're looking for Lyme, you're doing lymphatic and try to awaken it. I think testing during the full moon is what I've always been taught is just to test when they're most active.
Yeah.
And then when you're obviously having good valve movements to where, if you're doing the stool test to where you can really get a good sample, but I don't think that there's any necessarily things that are going to push out more to make the testing or anything that you can take. I mean, obviously eating sugar and things like that we wouldn't want you to do are going to make them more active and kind of alive. But I think it's just testing during the right time.
Yeah, I think that's number one for sure. I'm just thinking through that in my head. And then, I mean, there's probably things that they don't like, right? Anything they don't like that's going to make them more active.
Seed, things like that.
It might not be a bad idea to do that and then do some testing
Right.
because it's going to activate them a little bit, right? So that's not a bad idea. Again, I'll look into that. I don't know why I didn't think of that, but that's a good idea.
Right.
All right. How long will this go? Oh, yeah. So we're probably 6:15-ish. Somebody asked how long will it go. That was a long time ago, though. What's the best way to kill pathogens while supporting the immune system?
Right.
Again,
all the ways we talked about.
Depending on what the pathogen is, that's the thing. When we get into individual care here, one of the things we do really well is pillar 4 of any autoimmune or cancer or any chronic disease are the causes. So when you test it properly, whether it is parasite testing or heavy metals or bacteria, viruses, etc., there's a saying, you can't fix what you don't find.
Yeah.
So we have to fix it first. I like to go in order of priority based on the subjective feedback, right? What you're telling me. I have patients, I grew up on a farm and there was pesticides everywhere. Okay, that's the first place I'm going to look. Or, breast cancer patient says, I just had one today. She said, my stress, she was in the medical field in a very high stress environment. And she said, then life in general was very stressful. And she just went on. That's probably the first place we're looking, right? So again, it's subjective feedback, but then again, we find stuff and we're like, ooh, I didn't think it was that bad.
Right.
We might start there.
Yeah.
Supporting the immune system comes down to things like there's a cell called a T regulatory cell. The T regulatory cell is like the traffic cop of the immune system. It regulates your T cell function and your B cell function and a lot of other things too. But that T cell the T regulatory cell traffic cop can become drunk because of too many fuels to the fire.
Right.
So if it's inundated constantly, it's constantly trying to regulate the T and the B cells. There's more to this story. But the vitamin Ds of the world and the glutathiones of the world are very, very good for sobering up the drunk traffic cop. Your curcumins and resveratrols are very good to pour water on that cytokine fire. Your omega-3s also are very good for these they call it the TH1, 2, 3, 17 pathways. So those are things that you could definitely do to regulate the immune system. But then to support it, these high dose vitamin Cs are really, really effective. And your Myers cocktails that have a lot of the different magnesiums and minerals and B vitamins and vitamin Cs. So there's a number of different ways. I just touched on a few there, but there's a number of different ways for sure. Is cancer carried in parasites? That I don't think I've read.
I haven't read that
I don't think
before.
it's carried in parasites. I think the mechanism that we described, that the immune system goes after these multicell organisms, creating the toxins, which then in turn create these inflammatory cytokines and chemokines, which then can cause the cells
So it's the harm
to break
of the
down.
cell.
All right, diagnosed with MBC to the liver. I have seen a variety of parasites come out my stool, also large parasite MRI. I've also done stool tests and have microscopic parasites.
Wow.
A lot of therapy, have tried a lot of therapies and cleanses, have done them more than once. I have been fighting parasites for at least 4 years. I noticed sac of roundworms many years ago come out before my diagnosis, did F-Scan and Firefly in Arizona, Firefly Incorporated, ATP. So how is this good for cancer patients? So again, it's one of those where that tells me, okay, if we're having that kind of parasitic reaction, there's something missing in the treatment. Because typically what will happen is we'll find things, whether it's with meds or the Firefly or biocharger or supplements or whatever, we knock it down, but then there's an environment that's created for these things to fester as well. So there's probably something missing in the treatment.
It sounds like there's something that is not allowing her body to kill. It shouldn't be over and over and over, right? It shouldn't be a long term if you're doing the right protocol, right? If you don't know and it's had years to live in there, but maybe there's something missing in what you're doing.
So we're co-jointly, I would call it, or concomitantly, we're boosting the immune system significantly. We're testing, that lymphocyte map with a test called Cyrex Labs. We're looking at your secretory IgA of your gut. That if that's low, it's kind of like a boxer in the 15th round. your digestive system's very weak, you could need colostrum, which is immunoglobulins. You could need short chain fatty acids. There could be a lot of things I think that might be missing in that care, other than just trying to kill the protocols. I think there's a lot of other things that probably need to happen as a result of that.
Right.
Addressing gut health is probably one of the big ones. And then your immune system is probably the second one. Can conditions like mastocytosis be caused or associated with parasites? Yes, I will say just simply yes, because of the reaction of the immune system to the parasites, it absolutely can. So it's going to have a major effect on the immune system in general. So yeah, without question. Top 3 tests we talked about. We went, Firefly, F-Scan, probably Molly, the bioimmune, as well as your stool, your very extensive stool ecology, probably optimally around the full moon, and taking probably 4 or 5 samples. The tough part is it's quite expensive. So that's the last one is
the stool
doing
testing can be expensive.
It's really good, but it's hard. It's because of the expense. So I have all those symptoms. I've done stool testing. Results have been no parasites, but my blood inflammation markers are high. Parasites are opportunistic. How can we effectively get rid of them? So I think we answered that.
It sounds like you need a little bit more testing, even though you've done the stool testing. As we mentioned, a lot of times it can't be found, or maybe it wasn't just the right time in the month to test. So I would recommend doing the bioenergetic frequency testing to see if anything can be found that way.
All right, so killing the parasites. This person has chronic Lyme, agitate the nerves for sure, and give me horrible nerve flares that last for hours. Taking black walnut hulls, Artemis, and clove cause a lot of pain. I would love to learn a gentle way. Also, the Firefly didn't work. Before you, and you may have done a lot of this, but especially with Lyme, there's such an agitation to the inflammatory response because of the chronic fight that's going on. So making sure we get that calmed down. So I'm not so sure if that's been addressed as well as it probably could be, because if it is, then we should be able to do our due diligence with the parasite. So there might be some things still going on, maybe those co-infections, things like that are probably creating, I'll use the term, a loss of buffer. So the way I explain the immune system is, if my immune system threshold is here where it's firing, and say I start here and I have, my gut's good and I don't have many infections and my immune system is pretty calm, I can eat this and breathe this and do this, still not fire off the immune system. But if I'm right here, because it's very active, every little thing can throw it over the edge. So when you try to kill, say, a parasite, you're creating an inflammatory response. And that inflammatory response seems to be just too much for your body to handle. So the idea, trying to keep it as simple, is to get rid of as many of the fuels to the fire as possible so you have more of a buffer so you can tolerate it. Neil Nathan's book called Toxic goes into that a little bit as far as the Lyme and the mold situation, but it does sound like you're too sensitive right now to handle it. So I'm not sure many things would work. I think we have to go back and address that Lyme.
And I think I've seen that in a few Lyme patients now, where the treatment of Firefly is usually very tolerable. It's gentle. A lot of people have no symptoms from it, but the Lyme patients are the ones that I tend to see that really get symptomatic. They get flared up because of the Lyme, because they haven't really addressed that fully first. So that can happen.
Agree. Garlic enemas on a regular basis. I mean,
so Molly is one that loves the garlic enema. She's the one that does the bioimmune. We do more so the coffee enemas kind of on a regular basis. That also I've seen patients that have passed parasites with coffee enemas, and we stick to the garlic more so around the full moon. I don't think it would be necessarily harmful to do it outside of there, but that's basically parasite only. It's specifically for parasites. So that full moon is really the best time. We try to do it like 3, 4, 5 days during the full moon.
And you might be talking prevention, you know, I don't know that there's a major downside. I don't know that off the top of my head, but
like too much.
If you did it, a little bit,
as
a
like
little bit throughout the month, and then you really worked hard on the gut, and do some of the other strategies we talked about, probably not a bad thing, you know, from a maintenance standpoint. I think that's not a bad idea. I had a patient couple months ago that is she basically has farm animals,
Mm-hmm.
and she has to give them anti-parasitic almost daily. I think she
Wow.
said daily. She said, I just started taking some of
Yeah.
it, maybe every couple days.
Yeah.
She's like, why not? And I said,
Yeah.
well, how do you feel? She's like, I feel fine. So,
Yeah.
so
Right.
I'm sure.
I don't think they would be
yeah,
bad things.
the garlic
to
enema is probably a lot
necessarily-
less innocuous
Right.
than that.
Right.
So I think you probably
You could
be
eat it
okay.
every day. Why would, yeah.
But her mentality made sense. She's like, we give it to the
Yeah.
animals. Why wouldn't we take it? I go,
Well, that's the big
I
thing.
don't know.
It's like, why are we deworming and testing animals all the time that are in our lives, but not us? Yeah, that's always.
Yeah. So she
big
said that. I'm
question.
like, I don't have an answer. And it made actually practical sense.
Yeah.
Right.
She's ahead of the game.
All right. So myself for kids and parasites. Well, how much
Sure.
does it cost to get tested for parasites at the
Mhm.
center? So you're.
So it depends on what you're doing. I think Molly's testing is $250. That's the bioimmune.
Mhm.
The F-Scan is $75. And then the gut ones or the stool ones, they vary. I think they
Mhm.
start around 300 and maybe go up from there, but you're getting more than just parasite testing. It's looking at, again, all of the gut. So
Mhm.
keep that in mind.
Yeah. True.
And
And a quick question for you. As far as the database,
mhm.
would you say is it super thorough as far as what the most common is it?
Right.
Is it include almost every helminth, every protozoa?
There's
Tell me.
about, I would say, 100
Okay.
parasites in there.
Okay.
And there's more parasites than that. I
Sure.
mean, it definitely doesn't have everything,
Mhm.
but it has a major
The majority of what we
majority
see
of
on a
what we
daily
see.
basis, right?
Exactly, exactly.
I wanted to point that out only because it's a phenomenal tool, but if there's one small,
Right.
small downside, it's
Yeah.
just the database
Yeah.
isn't as extensive.
Right.
And so that's usually why I'll recommend them see
Yeah.
Ashley for sure, 100%, because that's too easy.
It's
too easy of a
$75, it's
solution.
2
Yeah.
minutes. Yeah.
And then see Molly too to see what she finds with her testing as well. And maybe if somebody's really symptomatic gut wise, I'll do the gut zoomer as well, or the GI map.
There was a patient who did a stool test, and it was a one parasite that I had never seen before. And I went and I looked, and it wasn't in the database. So it is.
It happens,
there
but
are
it's rare.
things that are outside of it, but it has the majority. This person had a very rare
Mhm.
type that we don't see often. So
I'm a big fan because I see this with the cancer. Is if we test it thoroughly in a multi-direction way,
yeah,
and we treat it multi-directionally or multifaceted, it works.
yeah,
And that's just
Right,
what I think. That's use the tools that we have here if you can. Should be testing myself and kids for parasites as preventative. Based on what I know and what I've learned,
Yes.
I definitely would.
Patients
definitely
ask me
would.
all the time.
Yeah.
Okay, we've got a negative test now. We've retested. I'm negative. When should I come back and retest?
Yeah.
Obviously, if you're starting to get your symptoms back, but at least come back every year or every 6 months, because we know how easy it is. You can clear everything and then go get re-exposed
Yep.
at your next, night out, date night. So
Yep.
it's
Exactly.
definitely
true.
good to keep it as a tool in the toolbox of, your yearly testing.
And how's your health overall?
Right.
How's your food supply?
Yeah.
What you're putting into the body. How are your symptoms? How although all those probably
Right.
matter as to the frequency.
How often to do it. Yeah.
Exactly right. Let's see. Do you do the parasite test before anything? Which are the best tests? Which are covered by Medicare? Can we come to the center and do them, etc.? Okay, so do we test for parasites first? It depends. Meaning, I think in a workup
Yeah.
is what you're asking.
Yeah.
We may or may not. It
Yeah.
really depends on the symptom. So if I have somebody that comes in and overwhelming, they come in to see me for gut, which a lot do.
Right.
We're definitely going to send them to Ashley. I'll send them to Molly, and then I'll do a stool ecology.
Right.
I'll get all 3 of those data points back, and then we'll get to work, right? So yes, it does depend. Now, having said that, there's general workups. We do our blood work, complete blood panels. We do our complete metabolic panel. We do our iron and ferritins and hormones and vitamin Ds and inflammatory markers and thyroid and all those. That's
Right.
our general workup.
Right.
And then we get very specific for most of the doctors here.
Yeah.
I know that's
Right.
for mine for sure. And then we get very specific based on the subjective
Right.
data that you provide. And subjective means what you tell us.
Right. Right.
Then we go objective, what is on paper with Ashley's testing and or a gut zoom or something like that. And then we get to work on what's found.
Right.
Hopefully that made sense.
Yeah.
What is the correct and best stool test? Yeah, John, it's, the GI map, the gut zoomer, I kind of go back and forth with them. Gut zoomer is probably a little bit more expensive, but it definitely is more thorough.
Comprehensive.
Yeah, for sure. Yeah. So that's what I use as far as the stool ecology. And again, you have Ashley and Molly too that I use simultaneously. All right, let's see. Did I get the one up here?
Yeah.
Okay,
they're not covered by, I don't think any of them are covered by Medicare.
No.
But it's not something you really have to do over and over again.
Sure.
So it just depends on, if it's feasible.
Yeah. Remember the initial, if you were on, those tests are very limited in the conventional model. So I wanted to point out most doctors poo-poo this whole parasite thing, by the way, the conventional model, because when they test it, it may not come back positive because they're not testing it thoroughly.
Right.
So if they tested it more thoroughly like we do, I think they'd see that this is a big deal.
Yeah.
But yeah, so I'd leave it at that. All right, given what you share, can you share how to detox the heavy metals and candida? Yeah, a little bit. It depends. Some heavy, if I have a big load of, say, mercury, right, I've got to figure out where it's coming from. Is it amalgam fillings? Is it, or the mercury fillings? Is it fish? Where's the source? So we have to figure that out because we have to get rid of the source first.
Right.
And then we have to do we could do chelation, right? EDTA chelation. We could do, there's something called heavy metal drops we could do with chlorella.
Right.
There's really a lot of things, honestly. All that. And then for candida, it's the same. It's like there's so many different ways to kill it. We could do a natural approach with a diet. You starve the candida. Then you could kill it off with certain supplements. Candicid forte works really well. Biocidin to break down the film. Do megaspore. We do vitamin C with that. So there's a protocol for that. But then also, I may recommend diflucan or nystatin. Ketoconazole. I might recommend a med along with all that. So that gives you a little bit of insight. The machine that is used for muscle testing, that's the Asira, right? And then Molly does some.
We have the Bioimmune and then we have the Asira. Asira is another test we have that we didn't really mention, but it quickly will check your body's response to certain medications and supplements. And you could put it to parasites. So that's called Asira.
Okay, biocharger can be done in the San Francisco Bay Area. It depends if a provider has it. I don't think there's many biocharger units.
Right. It's not out there as much as some of our other modalities.
It will be.
Yeah,
it will be. Yeah. We're kind of, Keneally, God bless her, she's so ahead of the game because she reads everything all day long. Well, not when she's here, but on the weekends, she's definitely doing, it's her hobby because we get the emails and the text. Okay.
You could probably contact the company. They might be able to tell you if they have it there, but I'm not sure. Exactly.
All right. Cell sonic machine and whether it kills parasites. It can.
Actually, that's a great question because we have had success, especially if we know it's in one area, the liver or something like that. That is using sonoelectric pulses and PMF to really pound against the body. I don't want to say that word. That sounds painful, but it is. It's a very strong pulse. So that can dislodge or with the vibration of the machine, break apart the parasite too. Mm-hmm.
Do you do the parasite treatments while going through chemotherapy, after, before?
I think that kind of depends on the patient. Yeah. Somebody who's a little bit weaker and really needs to focus on their cancer protocols, and the doctor may say, let's wait. And plus, sometimes the chemotherapy can give a lot of candida and things like that, and it's going to be hard to kill off the parasites while all this other stuff is happening. But then we have some patients who, again, are very symptomatic, or maybe they're in our IPT low-dose chemo and they can handle it. So I think it depends on the patient. You definitely can. They don't contradict each other. But it depends on the patient and the doctor, what they think is
exactly. If you're doing really, really well and can handle that type of protocol.
I do have some patients that are.
Why not, right? If it's a big deal and we want to get rid of it, because the idea is to try to get rid of the causes simultaneously while you're getting rid of or you're doing the kill phase, right? Exactly. The pillar 2 kill phase.
They only have so much time. They're only here for so many months, and
so
it depends.
Priorities, right? We just prioritize.
Yeah.
You did describe the Firefly, so that's good. Kaiser doctor won't prescribe antiparasitics. Yeah, this is a lot of outside of the box stuff.
Right. We use compounding pharmacies. A lot of times with conventional, they're going to give you one parasite medication, literally one pill. So we even prescribe it differently here than you might have at your Kaiser doctor. A lot of patients try to ask if they can get their meds through their primary care. Yep. It's not going to be the same protocols that we use, therefore probably not effective enough.
Yeah, so yeah, great answer. This next question, the cadence of eliminating parasites. Have you seen cases where parasites have died off, but the patient still has candida and vice versa? Yes. I mean, we definitely like to do the candida first, for sure, and then heavy metals, and then go after the parasites.
Yeah.
But if the gut is not strong, right, and we didn't get rid of a lot of the stress, and we didn't change diet, and we didn't work on the microbiome and the leaky gut and things like that,
right?
Yeah, those things definitely have a high chance to come back. So yeah, we've got to definitely do what I call the 5 R's protocol of gut health. We've got to remove the foods, replace enzymes, revive the microbiome, repair leaky gut, and remove the infections, and kind of do all that simultaneously.
Yeah.
And again, some of these stool ecologies, even though they're not sometimes great for parasites, they really do give great insight on what else is going on in the gut, the microbiome, your inflammatory reactions, your secretory IgA, do you need short chain fatty acids? I mean, it really does a good job.
Right. It's great for all of that.
It is. Yeah. And that allows me to dial it in. And that's where we can individualize the care greatly.
Yeah.
How is it different seeing you rather than seeing Molly? Get that question all the time.
That's a good question. Yeah, we get that often. So Molly's testing, they both are doing testing through Bioenergetics. What hers is testing is the body's response to specific parasite supplements and medications. So if you're testing really strong for a certain supplement or medication, chances are you've got that parasite. Otherwise, why would your body be asking for that supplement or that medication? So it's she has a database of all the different supplements that we carry here and all the different medications that we can prescribe. So it's bioenergetically testing against those products. What the the F-Scan is doing is bioenergetically testing you against the frequencies of the parasites. So you're kind of getting the same answer at the end. Is there parasites? Yes or no. But one is telling you what to take orally, and the other is telling me what frequency protocol to use in the Firefly, or is giving the patient a name to the parasite.
And then killing it off with that frequency, which is great.
Exactly. And then that goes right over to the Firefly. So really the F-Scan is specifically for the Firefly treatment.
All right, gang, one more. Tooth decay comes up on the F-Scan?
There's a few things that are outside of kind of the gut that's was a right frequency that kind of got correlated into the database. So the F-Scan is actually from Switzerland. So it's actually separate from the Firefly, but the company has kind of put them together. So there is, I think, 6 or 7 different tooth decay, because depending on where it's in the mouth.
Okay.
And there's I think a gingivitis gum one too. So there are a few things that are in there that are outside of the mouth, and we can treat in the mouth. Most of the time patients are coming because they're concerned about the gut. But if they want I had a guy today, he says, I've got a lot of gingivitis, a lot of bacterial issues. So we treated the mouth. So it's an option.
Yeah. And the oral cavity, gang, just if you're still with us, the oral cavity is a big deal. Whether it is your microbiome of your oral cavity, these infections that can reside in there, cavitations, which are holes in pockets of bad root canals, mercury, big deal as it relates to chronic disease. It can
affect the whole body.
Yep. So, okay, gang, it's 6:30. We went a little over. We will get these questions answered. As we always do, Shep will put out the answers, over the next, say week or so. So we'll get the doctor's feedback, everybody's feedback. So I want to take the opportunity, gang, to thank you for being with us.
Yes,
I will, let me see here, get back to our screen here and just show you, we get these questions a lot. So at the end, we have the new patient inquiries. If you're wanting to come for the Cancer Center for Healing, the 949-8677 number, 6374, I should say, is the number. The supplement store, 949-997-0821 if you're interested in any of the supplements, and then 949-867-6419. is if you're interested in coming in as a wellness patient where maybe you have some gut stuff, maybe it's thyroid, hormones, things like that. The center side is the avenue to get in for there, or preventing cancer.
Right.
And chronic disease like autoimmune cancer, things
Sure.
like that. So that just gives you some of the, and then hyperbaric, we didn't mention a lot of that, but hyperbaric's phenomenal, and that is down there as well. Each of the websites are there as well. So
you
you
can
can
come
take
in
a
and
picture of
test
that.
us on either side.
Oh, yeah.
That was a question I saw on the Instagram.
Oh, what was it?
Do you have to be a cancer patient in order to come in and test?
Yeah,
These are available
definitely
on
not,
both
yeah.
sides of the clinic.
Because the same things that prevent cancer are what can kill cancer.
Yeah,
So
right.
we want to make sure that we don't have these fuels to the fire. So everything we talk about on here are things that I personally do, that you do. We look at these tests for us personally, and if we see things, we try to get rid of it, mainly to reduce that burden on the inflammatory process, which then will lessen the chance of the cells becoming damaged. So.
Yeah.
All right, gang. I know we went long, but we appreciate you.
Thank you for
Have a good
joining us.
couple weeks. Ashley, thank you so much. I think you did a wonderful job.
Thank you.
And we'll see you in a couple weeks, everybody. Much love.